All right, so we are looking at a surgery setup. For those who have not worked in a dental surgery setup, this is a typical setup that you are looking at. We're hoping to get people even who are not working in the dental surgery setup so that at least they're exposed to the program. If they wish to recommend anyone, at least they'll have an idea of what we're talking about. So that's just a surgery setup. How is our program structured? The Zimbabwe Academy of Dental Nursing Diploma. It has got 4 modules, each one lasting 4 months. Each module starts off with a seminar, usually about 3 to 5 day seminar. We hope it will continue as a face-to-face presentation, but it may end up as a Zoom presentation depending on the outlook of the COVID scenario. Each module for the Zimbabwe Academy of Dental Nursing Diploma is assessed as follows. A few weeks after the face-to-face seminar, usually in Harare, the participant takes a self-assessment or evaluation invigilated by his or her own dental therapist or dentist at their own workstation. At the end of the 4 months, when we meet in Harare at a venue, the participants write a 3-hour exam broken into theory paper 1 and then paper 2 is a clinical exam. They are also required to do a first aid training and also computer training. And last but not least, they are supposed to do at least 9 months of proven clinical attachment or proof of full-time employment. So that's how the diploma is structured. Today's presentation is a 45-minute presentation, which will be continued on 13 September and completed on 27 September. So today I'm starting the first part, which is about 45 minutes. The objectives for this presentation: first, we must be able to explain in simple terms what dental materials are. Number 2, we must be able to explain properties or characteristics of a good dental material. And number 3, we should be able to classify various dental materials and at the same time being able to give common examples of the materials that we use in the surgery. So what are dental materials? Dental materials are those things we use in this dental surgery other than medicines and drugs. We do use medicines and drugs in the dental surgery, such as anesthetics, antibiotics, creams, etc., etc. But then there are other things that we use to replace teeth, to repair teeth, to promote healing of the dental nerve, of the soft tissues in the mouth, to take impressions or replicas of teeth or missing teeth. All these things are generally classified as dental materials. So a dental material must be usable in the mouth, in the human body, meaning it must be compatible. It must not create problems when we use it to take duplicates of teeth, to repair teeth, to replace teeth. It must not be toxic. There's a small error on point number 2 there. Non-toxic and non-irritating. My apologies for the error there. Point number 3, it must not cause allergies. It must be non-allergenic. 4, the material must be mechanically stable and durable, meaning it must be strong, it must be resistant to breakage or fracture, it must not corrode, must be resistant to corrosion, and it must not deteriorate. These things are important because you don't want to repair a tooth, to do a filling on a tooth, then weeks or months down the line, the filling has shrunken, or it has cracked, or it has changed color, and all those other things. A dental material must be stable dimensionally. It must not be affected by things that we eat, by the temperatures of things that we eat, such as hot tea, cold drinks from the fridge, lemon, acidic foods, and so on and so on. A dental material must not conduct heat, meaning if we eat something hot, the temperature change must not be transmitted to the heart of the tooth, the nerve of the tooth. Similarly, if we eat something very cold, that coldness must not be transmitted to the nerve of the tooth. It must look good. A dental material, when used to replace, to repair, or to sedate a tooth, it must look reasonably attractive. It must be aesthetic. And when the dental assistant is mixing it for the dental therapist or for the dentist, it must be easy to manipulate. It must not be too complicated, so much that the dental assistant or even the dentist himself or herself will need a chemist to mix it. And last but not least, point number 10, a dental material must bond or glue or retain to the tooth so that it's able to do the job for which it's meant to function. It must be tasteless, and also it must not smell, and must be affordable. We all know that dentistry is one of the most expensive healthcare service, and the biggest part of that expense comes from the dental materials that we use. So we go to objective number 3. I'm skipping objective number 2 for now. We should be able to classify dental materials. Classification of dental materials helps us to be able to arrange them neatly and efficiently in the dental surgery according to general use. It also helps us to study them better, because dental materials in a certain classification tend to be manipulated, stored, and used for similar things. And they tend to behave also in a similar way. So this classification that I'm giving you here is not exhaustive, it's just a general working classification. Well, first, we can classify dental materials into restorative dental materials. That classification can be further subdivided into A, direct restorative dental materials. This means the materials which the dental therapist or dentist uses immediately after being mixed at the chair side by the dental surgery assistant. This is different from indirect restorative dental materials, which need to be prefabricated somewhere else in the dental laboratory by a dental technician. Then after fabrication, the artifact or the product is brought to the dental surgery, where the dental therapist and the dentist can then apply or attach to the tooth or to the teeth, such as bridges, onlays, inlays, post and cores, veneers, even dentures, etc., etc. Number 2, preventive and dental health education materials. These are materials such as floss, dental floss, toothpicks, interdental brushes, plaque disclosing tablets and solutions, and many others. Another classification, apologies for that error there, it's supposed to be 3, not 4. Impression materials. These are materials that the dental therapist and the dentist uses to take duplicates of the jaws, of the teeth, of the arches, so that later on when the patient's gone home, we can make replicas, replacements, that we can then fit or fix at a future appointment when the patient comes back. Then we also have materials used for dental implants, for and with dental implants, such as pins, special sutures, etc., etc. You will recall that we made an error for calling this presentation root canal related materials. We're supposed to call it just dental materials. But indeed, there's a classification for root canal related dental materials, such as root canal sealers. These are cements, rubbers, special rubbers like gutta-percha, pepper points, etc., etc. Then we have a miscellaneous type of dental materials, many of them that may not be easily classified. Let's go back to restorative dental materials. Like I said a few minutes ago, these are materials that help the dental therapist or dentist to repair or replace missing or diseased parts of a tooth or teeth. These materials include the famous and the most popular dental amalgam. We also have what we call bonding agents. These are materials that are used to glue filling materials, such as amalgam itself, but more commonly used to glue dental composites and glass ionomers, and even veneers and other things. 3, we have modified composites, sometimes referred to as resin-based composites. You also have another classification of restorative materials called combomers, which are hybrid materials between composites, glass ionomers, and other things. Then you also have ceramics, you have liners, you have bases. Cement bases are put under a filling so that the filling material does not affect the nerve inside the tooth. You also have what are called dental polymers. Then you have glass ionomers. Now, going back to direct restorative materials. Amalgam. I didn't choose amalgam by mistake. I chose amalgam because it is still a very popular filling material. It has been around for over 100 years. We know there's a trend worldwide to limit its use. But in communities and countries where resources are hard to come by, such as ours, amalgam still has a very important role to play, despite the resistance and the controversies around it. So what is dental amalgam? Dental amalgam is essentially a mixture of metals, fine metal powders that are mixed together, and the principal constituent there is silver. About 70% of the metal powder is made up of silver. Then you have other minor metals such as tin, copper, zinc. So how do you make a paste from this metal powder? You mix it with mercury to form an amalgam. That's where the name amalgam came from. And the mercury part is where the controversy about amalgam, or the resistance about amalgam, comes from. As we all know, mercury is a poison, and once absorbed into the body cannot metabolize it or digest it. However, we know the mercury in the dental filling material called amalgam is not released into the bloodstream. So hence, we still use amalgam. Amalgam is used mainly on back teeth, twin teeth. Can you kindly mute your device, please? Mute your device. When I want you to speak, I'll unmute your device. Kindly mute your device. Let's be a bit civilized. Let's be a bit civilized. Okay, thank you. Right, I think I can continue. Right, fine. Right, so where was I? There's an example. What you can see on the screen there is an example of a dental amalgam filling on chewing teeth. Am I able to show them with my case? I'm sure I'm able. Am I able to show them there with my case?
Okay.
Can you mute appliance? Mute, just click mute, please. So this is a dental amalgam filling. Many of the dental assistants and the dental therapists and the dentists who have joined, they are familiar with this. But we may have visitors who are not therapists, who are not dental surgery assistants, who are not dentists. So I'm going to take a few more minutes. As you can see, this silver amalgam or dental amalgam is nicely polished, it's shiny, it's smooth, and clearly we shouldn't have any health problems as a result of this filling material. On your right, in the mouth, you can see also a nicely done amalgam filling on a molar. This is lower left of this patient who's opening his mouth. So that's dental amalgam. And the job of a dental assistant is to mix this material for the dental therapist or the dentist so that they can pack it and carve it and polish it nicely like this. Now move on, shuffling. So how is amalgam, dental amalgam, prepared by the dental surgery assistant? There's a way, a proper way, a professional way of proportioning it and dispensing it. Proportioning means you need the right quantity of powder to mercury. Then once you mix it, you need to hand it over to the dental therapist or the dentist so that he or she can then pack it and use it in the right place. Luckily, nowadays, the dental assistant no longer needs to do it manually because now dental amalgam is sold in capsules. It's sold in pre-capsuled or pre-packed capsules, which you just stick into a machine and the machine mixes it. But before then, the dental assistant used to mix it manually. So this process of mixing dental amalgam is sometimes referred to as trituration, just a bit of professional words there, so that we also use professional words. So the machine is on your right side. It's called an amalgamator. And inside the amalgamator, you can see a capsule there. I show them the capsule. This is the capsule in an amalgamator. And this is an amalgamator machine. But years back, as you can see on your left, the dental surgery assistant used to do it manually. And they even had to squeeze out excess mercury so that they end up with a correct texture of the amalgam. And this person is wearing gloves to try and prevent mercury from being absorbed via the skin. So this was a very messy process. And they used a mortar and pestle, to mix it. Then put it in a napkin and squeeze the excess mercury. So this was quite messy. But now, luckily, due to technology, we don't have to worry about that. But we do explain this whole process so that the dental surgery assistant can appreciate if the dental amalgam product does not meet accepted quality, what would have gone wrong. So that's why we explain this whole process. Can I go back to? So that's the titration mixing. On your left there, that's the dental amalgam capsule, the pre-capsulated dental amalgam. There are different types, different colors, even different sizes. We talk of spills, single spill, double spill, triple spill, and so on. On your right, it shows what's inside once you open the capsule. You can see the powder there, the metal filings. You can see the shine mercury there on top of a membrane, which was dividing the powder and the mercury on one side. That membrane is only broken once you put it in the machine to start mixing it. So the machine comes with a timer. You need to put the correct time or plug in the correct time, because there are problems of over-mixing. There are also problems to do with under-mixing or trituration. If you over-mix or over-triturate, you reduce the working time. It means the amalgam starts getting hard before you hand it over to the dental therapist or the dentist. Similarly, if you under-triturate or under-mix it, the product will be too runny or weak. As a result, the final dental filling may be weak. And also, that might force the patient to continue opening their mouth while waiting for the filling to get sizable hardening. And the other parameters also, like compressive and tensile strength, which are affected by over and under trituration. So the dental assistant has to learn all these signs. So I'm going to show you a little bit about how the machine works, the video. So this is how Right, so I've just shown you how an amalgamator works. Pretty fast, efficient, and easy to use. And these are some of the issues that a dental surgery assistant has to understand about trituration of amalgam. But always read what we call the material data safety sheet, MDSS, because different products have slightly different specifications to do with how much time you need to program the amalgamator machine, how much force you need to program the vibration force, and so on and so on. Even the expiry dates and so on. So always read the material data safety sheet, which is enclosed in the packet or the package of the amalgam. And don't throw it away until you finish using the product. And because of the mercury that I talked about, there are safety issues that the staff in the dental surgery must grapple with, and the dental surgery assistant is the manager of that whole area to make sure that everyone adheres to the safety issues. How am I doing the time? Need to put on gloves, face masks, goggles or glasses, avoid direct contact. All right. Avoid direct contact with the amalgam itself. The leftovers of amalgam must be stored properly, usually in a sealable jar with water or fixer. And also avoid heat, using amalgam directly close to heat, because that will force the mercury to evaporate into mercury vapor. Should have good ventilation in the dental surgery. Open the windows, have a fan running. And of course, thanks to technology, we now use capsulated amalgam. So like I said, this is a 3-part series. Today I'll end at dental amalgam. Now that we've got the feel of the speed with which we present, on 13 September, we'll start on dental composites and we'll move much faster. For those of us who are students, please read up about dental composites. Read up about glass ionomers, combomers, impression materials, etc., so that you are able to enjoy the presentation. Thank you very much for all those who have joined. And those who need CPD points will email the CPD certificate to your email. You could send me your email by WhatsApp. Then Jerry will email the CPD certificate to you. So let's meet again for about 50 minutes on Sunday, 13 September. Installment will be on 27 September, also on Sunday in the afternoon. Thank you very much. Have a good weekend. Bye-bye.